program for the COVID-19 vaccine. I had a discussion with the CEO, Caroline Kariuki rather. Let's now get a bit of that interview that we had earlier on.
Is not giving a note to private sector to import or to distribute any vaccines. What we are doing with the government, with the Ministry of Health, we are supporting them in their vaccination efforts. Okay. Already we began by supporting through our medical facilities, the private sector facilities, offering them to be used as as vaccination centers. And we also used sometimes some of the sports club where doctors could come and be able to vaccinate the employees of the club and the communities around. That had started happening. But we said we could do more, we could support government more. And because we support government in so many initiatives, wherever we have capacities or comparative advantages. So what we're doing now with the Ministry of Health, we said, as you're looking into vaccinating and we get into herd immunity, how can we support you? And so we are mobilizing funds to support the initiative and bring more vaccines, and so that government can bring in more vaccines that can reach to many more people.
Very well. That story right there ushers in our discussion for BizChat Weekly, where we normally have Ken Gishinga, CEO Mentoria, and a regular at our show right here. Ken joins us live from our town studios. Ken, good to see you once again on the show.
Thanks for having me, Brian George.
All right, and we're also joined by Mr. Ohoro Ndoho, who is former Deputy Debt Manager at the Central Bank of Kenya. Ohoro, always good to have you. He's joining us virtually on Microsoft Teams. I'd like now just to pick your mind, Mr. Gishinga, on the stand by the Kenya Private Sector Alliance on assisting the government really in trying to get these vaccines in the country. What do you read in that motive?
Well, I think for me, it's been pretty disappointing from what the Private Sector Alliance is doing. The government has been very clear in issuing out the COVID containment measures. The Ministry of Health has been very clear in what needs to be done. So it does not need the private sector to repeat what the government is already doing. Most businesses were expecting the Private Sector Alliance to look into the challenges that businesses are having, challenges of liquidity, challenges of servicing bank loans, challenges of layoffs. These are the things that the members pay annual dues for there to be a deeper discussion on. So for me, I think it's pretty disappointing that the Private Sector Alliance would choose to be a department of the Ministry of Health and continue putting out initiatives that are already in place.
Interesting. Ohoro, do you share in Gishinga's sentiments, or you are totally in agreement with the private sector?
No, I take a different view. I mean, I understand the position that Gishinga is saying, and I think there's a merit to it, because the reality is there are far more pressing things, I think, as far as economic recovery. But to me, the issue that I think what they're doing is, KEPSA is saying, the efficiencies that come from the private sector, why don't you leverage them for other things? Today maybe vaccines, tomorrow maybe disaster recovery. And I think it's a whole notion of, even if you think about it, even the public sector is a derivative of a private sector, in that the public sector is primarily funded by taxes on the private sector. So to the extent to which that the private sector has far more facilities, far more staff, far more resources than the government, why not use it? I'd only question it if it's a question of the government has been unable to. But I think it also speaks to another issue that I'd be very interested to hear around the whole question of vaccine hesitancy, and to what extent that is also playing into this, and therefore the need to use the private sector to reach Kenyans.
Gishinga, I'll come back to you on this, because, we want a quick recovery of the economy. Of course, COVID-19 dealt blows to various sectors of the economy, and the private sector is now coming in to support the government. But you are of the contrary opinion that that shouldn't have happened. So what do you think the private sector would have contributed in this case? What would you recommend, really?
With this pandemic, there are two elements to this pandemic. There is the health part of the pandemic, which the Ministry of health is addressing very well, then you have the economic part of this pandemic. So be expecting the private sector representatives to be having more engagements with the Treasury Cabinet Secretary, to be having more engagements to see what kind of stimulus packages can be done to save businesses from collapsing. I think this is where the members were expecting. We should have seen maybe a round table with the president to see what supplementary budgets can be done to be able to release some liquidity, particularly into the key segments. So I think we have to really be clear on who does what. Let the doctors and the health experts take care of the health part of the pandemic, but let the private sector businesses really work with Treasury to be able to find a solution.
Mr. Ohoro, as we put this matter to rest, the private sector partly said that they're going to, also stake some money in importing the vaccines, of course, ostensibly to, first of all, vaccinate the staff and, assist also in the government efforts towards vaccination. What's your take on that? Or do you think the money should have been invested in other, perhaps, priority, projects or the like?
To Geshinga's second point, I absolutely agree with him. There are far more important issues around recovery, economic recovery, and in fact, you could say you could argue the fact that the economic dislocation that has been occasioned by COVID has itself probably cost more lives than the disease itself. So to the extent that the conversation around economic recovery is not one that seems to be center stage, I completely agree with Geshinga. Beyond that, though, there is also to recognize that when you're mobilizing for a national emergency, then you use all the bullets in your gun, so to speak. And to that extent, I think that's the view behind why KEPSA has offered it. But like Geshinga says, and I'm not changing my view from the first time, I'm saying in the conversation around what the focus of KEPSA should be, it doesn't have to be mutually exclusive. I think it can be both, but I think it's good from Geshinga's point of view to remind ourselves that the KEPSA is there to, advocate for the recovery and prosperity of the private sector.
Amazing. Of course, we've heard from our experts and the panelists right there, Mr. Ken Gishinga and Ohoro Ndoho. We are still continuing with this conversation. So if you would also love to hear what you have to say from home, do join us in the conversation at KTN News KE. What are your sentiments on KEPSA's, KEPSA's effort towards supporting the government in achieving mass vaccination that perhaps would be effective for you and the economic recovery? Join us on that conversation. We'd love to sample some of your comments at KTN News KE, at Brandy_KE, the hashtag BizChatWeekly on KTN News. We now want to go back to our stories. So players in the hospitality sector found guilty of not observing COVID-19 protocols will risk losing their licenses for 1 year. This is according to Tourism and Wildlife Cabinet Secretary Najib Balala, who was speaking at his offices here in the capital, Nairobi.
Protocols to mitigate the spread of COVID-19 in the hospitality industry were first introduced on the 29th of May 2020. They include, but not limited to, 1.5 meters social distancing, safety and hygiene practices, regular health checkups for staff, and adhering to the curfew timelines. CS Najib Balala has reiterated players should strictly follow the safety protocols.
Particularly with pubs and restaurants who break the law, we will shame them. We'll have a list of shame so that people do not destroy the sector because of a few greedy people. And we will take action on those individuals. PERAC is here. They have committed to us, and they said whoever of their members or non-members in that sector break the law, we will name them and will take action. And I said very clear that even their licenses will be cancelled for 1 year.
Tour and travel companies, food and beverages outlets, as well as recreation facilities will also be required to develop and implement COVID-19 vaccination policy in their business.
We are now going out and encouraging all our members, all tourism players, to please get your staff vaccinated. We did get some vaccines from government a few months ago, and we are still in talks with CS Balala here to avail some more within the next few days.
We believe vaccination is the one that will make the industry recover faster. People are now, even clients, are asking, is your facility already vaccinated? Then they feel safe to come. So anybody who does not want to be vaccinated, then the revival of your sector will be a problem.
Tourists visiting the country are required to have a negative PCR test.
Our position is PCR, negative PCR certificate. I know people are saying we have double vaccine, why should we do PCR? You have seen the experts, irrespective of your double vaccine, the Delta virus is more dangerous. So we will need you to have the PCR certificate to show it is negative for you to come into the country, so that we are sure that you are not coming with a virus. And when you depart the country, you also take a PCR certificate check, so that you don't go with the virus outside the country at the same time.
The tourism industry contributes about 10% of economic output and employs over 2 million people. Brenda Kirubu, KTN News.
Very well then, we want to continue our discussion here with our panelists, Mr. Ohoro Ndoho and Ken Gishinga, on the same. That story right there sets the pace for us. Mr. Ohoro, and I'll let you go first on this one. This is a sector that contributes about 10% of the country's GDP annually. The good CS Balala is now coming out to tell the hoteliers that, hey, listen up, guys. If you guys don't comply with the COVID protocols, we're going to issue some sanctions. We're going to withdraw your licenses for 1 year. What do you make of that? Is a warning shot enough, really?
I also have a bit of a contrary opinion on this. And that's around the question of even as you impose those restrictions, to Gishinga's first point, what are you also doing to help them recover? In other words, the easier part to do is to come down hard with the law. But you know, we've been in lockdown pretty much on and off for the last 18 months. And so even if we are applying this, I think the temptation to come down hard without necessarily facilitating the industry in practical ways is a conversation that's rarely had. So let me give you the example. Hospitality industry is not just where the middle class goes. Hospitality industry is a booming business in informal settlements. How do you go about fixing that? How do you go facilitating that set of business? And I can easily imagine a majority of Kenyans are in those informal settlements. So how do you go about fixing or helping the private sector in that space to comply with the law, rather than just say, you know, you have to comply? You know, there are many ways in which, for example, it would be very useful to have a mask distribution system, you know, in every informal sector, in every hospitality. But it's questions around not so much regulation, but facilitation that I fear that sometimes the debate gets lost. It's easy to regulate, it's much harder to facilitate. And that's, I think, the space, especially given the economic circumstances, that we need a lot more help in that facilitation. It's a private sector.
Great. I hear you when you say the government should be supporting the hospitality players to, you know, recover and, of course, come back to business properly. Now, this is why I pick Ken Gishinga's mind as we bring this conversation to a close. Ken, we have seen the government, you know, having a sustained campaign towards domestic tourism. Of course, it has, for the very first time, we have seen a spike in the numbers of, you know, people taking up the domestic travel. Of course, there were incentives that were being offered by the government. But then we have also seen some very funny taxations coming up in the Airbnb sector, which is a different business model from the mainstream accommodation system. What do you think? Is that counterproductive to the tourism industry, and what would you recommend, especially at times like this?
Well, that tax on Airbnb is part of really the digital service tax that a lot of these apps and platforms in the digital world are facing an additional taxation, which is punitive. And at a time when we want to support businesses, we want to reduce the cost of doing business in Kenya, particularly for the hotel segment, one gets the feeling that we need to be lowering taxes and not increasing taxes. And these are the things we would have been hoping the tourism CS to be doing. Again, I said, when the CS of Health gives directives, he speaks to all Kenyans. So there is no need for the tourism CS to come and add these additional measures. He needs to be looking at what are the solutions for hotels, for investors in tourism, to be able to survive. What is the funding available to be able to support it? Because in as much as, yes, we do have domestic tax in Kenya, domestic tourism in Kenya, most of the hotels in Mombasa really depend on international tourists. And if you look at what's happening in the UK, Kenya still is not on the list of countries where our citizens from the UK can travel safely and back without a quarantine. So the tourism CS needs to be asking themselves, how do we get back to that list? How do we work with foreign affairs to get back to that list? Because we do need those international tourists. How can it be that countries like Chad and Afghanistan are on that list, but Kenya is not? So I think this is where the hard thinking that the tourism CS should be applying, but not really echoing what the health minister has already said.
Many thanks for joining us, Mr. Ken Gishinga, and always thank you for your sentiments right here on BizChat Weekly. We normally have it every other week right here on Friday. Thank you so much, Mr. Ken Gishinga, CEO Mentoria, and Wohoro Ndoho, former Deputy Debt Manager right there at the Central Bank of Kenya. Of course, do join us in the conversation. We'd love to hear your sentiments from wherever it is you're watching, at KTN News KE, at Branji_KE on that conversation. We'd love to sample some of them. Let's now get you back to our stories of the day. Players in the hospitality sector are slowly